Hello, everybody, and welcome. And today I'm very pleased to talk with Yvonne, that's Dr. Yvonne Waft, who is a clinical psychologist and who's written a book called Coping with Trauma. Now, if you've been listening recently, we've also done a couple of others. So there's a series called Coping With, and we've done endometriosis with Dr. Kirsty Young and Coping with Breast Cancer with Dr. Sarah Swan, who we've previously interviewed. Honestly, I think must have invoicing on the brain. And all of these books have been so practical because they are based on each author's own personal journey with what we're coping with, along with the fact that they are all medical professionals working from an evidence-based background, which, as we know at Talk Health, is one of the things that we find really, or we believe, are very important. So welcome, Yvonne.
Thank you. Lovely to be here.
So I think with Yvonne, I think what would be really good is if we could start with your story, which is obviously the background of how you came to become a clinical psychologist. And I have to say that after reading your book, I was shocked and felt I'd been on a journey with you from your childhood through to your 30s and 40s and beyond. It was fascinating and insightful as to how we can all grow and recover.
Yeah, thank you. So yeah, bit of a health warning. There are some shockers in my story. It's not the most easy of stories to hear, I think. I forget that because, as I said to you earlier, it's old news to me. But when you're faced with it, it's quite confronting, isn't it, when you're faced with it for the first time? So I came to clinical psychology a little bit late in life, later than perhaps some of my peers, because I'd had a bit of an interesting journey to get here. So it starts, I suppose, as most people's story does, with childhood. I didn't have the easiest of childhood experiences. I had a quite abusive father. Now, having worked in clinical psychology for a long time now, I don't for a minute suggest that mine is one of the worst stories out there. Far from it. I've come across far, far, far more traumatic stories in the people that I've worked with. However, it wasn't great. My father was quite verbally abusive, could be physically abusive, and was certainly very, very emotionally abusive as we were growing up. So that was the first thing. So I was growing up in an environment where, I was being criticized on a regular basis. He was very sexist in his approach. So boys got different experience than girls, really. And so as a girl, I was told I was less than. I was criticized for being female, for being weak. But then if I did anything strong, I was criticized for not being girly enough. So I couldn't win, really. So I had a pretty tough childhood. I remember at least one occasion of being hit by my father when I was very, very young. I remember being shouted at, being criticised, being put down constantly. So that was kind of the backdrop. And I suppose that happened in the context of nobody else really there protecting. So my mum was there. However, I think, to be generous, she was probably equally a victim of my father's misogyny and general aggressive nature. So she wasn't able to protect, she wasn't able to be helpful. So against that backdrop, I grew up. I wanted to get away from home quite early in life. I did my A levels. I was, capable at school, and that was my sort of saving grace through childhood, was being capable at school. Got through school, got my A levels. They weren't a great bunch of A levels, but they were enough, and they got me away to college. And I went off to do hotel and catering management initially, just because I'd been doing a part-time job in a hotel and thought it seemed a bit glamorous. So that was kind of the level of my thinking at the time. It was just get away from home by whatever means. And that seemed the easiest route away at that time. So I went off and did that. And then midway through the first year of my course at college, I contracted bacterial meningitis. And some listeners may have heard of that. It can be recovered from relatively easily, but very often the bacterial form of meningitis causes very serious health problems. So in my case, what happened was I ended up with sepsis and gangrene, and I lost both of my legs and was left with quite a lot of scarring as well on my arms, a little bit on my face, and just generally quite a bit of scarring. So I was very, very ill for a period of time, and I was significantly disabled as a result of having this condition. I think I was in hospital for about 7 or 8 months, being put back together with skin grafts and various treatments to kind of, physio, occupational therapy, all those kinds of things, to get me back functioning. And obviously being in hospital for a long time, you're vulnerable to infections. And I think I had various chest infections and things and water infections along the way. So it was quite a rough journey really for those few months. And then I came out of hospital. This was the mid 1980s, came out of hospital late on in 1986, I think, and was kind of thrown back into my parents' home. Nobody really asked me if that was what I wanted, and there was just lots of assumptions made that I'd be sort of launched back into the bosom of my caring family, which little did they know. Anyway, so I ended up back with my parents. My father continued to be abusive. He just had more to be abusive about then. So he put all sorts of obstacles in my way. He was really not very supportive of me as a disabled person. I think he wished I hadn't have survived, to be quite honest. So there was that. I set things in motion as soon as I could to move out of there. I spoke to social services, I spoke to the council, I spoke to local housing people, and I did get out. I got into an accessible flat, bungalow, can't remember, moved out of my parents' home and gradually rebuilt a life. Did various sort of bits of college course, did various bits of trying to get work, ended up after a period of probably about 7 or 8 years, I ended up moving to London to take a job, which was in sort of disability access. So as a wheelchair user, it was an important area for me, and it was a job that I was able to really throw myself into. But very quickly in that job, I started to think, well, you know what? I shouldn't really be the secretary here. I should be kind of the person having the ideas. I'm an intelligent person. I've got A levels. I should maybe go to university. So I started thinking about uni and careers and what I could actually do. And bear in mind, this was still probably early to mid 90s. We still hadn't even got the Disability Discrimination Act in place in this country. That didn't come in till late 1995. But there were moves towards that, and there was a lot of talk about disability rights and disability discrimination. And, the MP, Alf Morris, he was a deaf MP, and he was really working hard at that time to try and get disability rights on the agenda. And so I looked into going to uni, and because I was living in London, I ended up going and doing a psychology degree at the University of East London. And that was really where I started to grow and explore trauma and think about where my career might go beyond that. And I started to think about clinical psychology as a career option. The people at my uni were typically saying, well, clinical psychology as a course is really hard to get into. It's really competitive. It's probably not worth bothering. Probably, nobody will probably get in. And to me, I'd already overcome quite a lot. That was a bit of a red rag to a bull. And I thought, right, I'll do that then. That's the hard one. I'll do that. And so off I went, kind of, got my first class honours degree in psychology, and then started looking at getting experience and, looking towards getting onto the doctorate. Ended up moving back up to Yorkshire, and round about, I think, 2003, ended up on the doctorate in clinical psychology course at Leeds Uni. And that's kind of as potted a summary as I can give of how I went from, teenager not quite knowing where I was going in life to clinical psychologist.
It, what's interesting, it's the rebel that was in you to start off with, because I think in your book you say that you were, they had your parents and you had high hopes of doing Oxbridge, but you were just rebelling against that and went to do a sort of a hotel management course, which was obviously not as challenging as that they were or you were expecting. But when you went through your second trauma, which is
Hmm.
obviously of the sepsis, were you given much support? So yes, you mentioned that you were given the physios that were helping you, but you didn't really mention anything else.
No, I don't recall ever particularly being offered anything psychological or emotional in terms of support at that time. Now, maybe it was offered at a time when I wasn't very receptive. Maybe I was high on pain medications at the time and I didn't notice, but I don't recall ever being offered any sort of psychological support. And I'm jolly sure I needed it. Looking back, I really needed, trauma therapy at that time. Or maybe not immediately at that time, but I needed some emotional support and then maybe a bit later some trauma therapy to kind of reflect and review and reprocess all of that. And I don't recall anything being offered at that time or at any time later, any support of that nature. I've ended up basically either accessing through work at different times or paying for myself. It's never been offered to me, to my knowledge,
And I
since
think
that
what's
time.
interesting that well I found interesting is that, and we'll talk about trauma now, you know,
Hmm.
as you as a clinical psychologist. But the one thing is that, you said, which I thought was very interesting, was how we just accept, quite often we'll just say, well, this did happen, and we jolly it along. We try to
Mm.
see the positive in it, which in fact is brushing aside and glossing over the issues that are still there and need to
Hmm.
come out. And I think that's quite a common thing when people say, no, I can cope, when
Hmm.
actually you're brewing up for more trouble.
Yeah, absolutely. I think Judith Herman, who wrote about trauma and recovery way back in the early 1990s, talks about the dialectic of trauma, which is the approach, avoid kind of response. So when we've been through something horrific, whether that be the death of a family member or an illness like I had, or an accident or a natural disaster, combat experiences, when we've been through things that are beyond what we normally deal with in everyday life, way beyond, um, we've got two choices really. We can either face it and really kind of feel the feels and, notice how that's impacted us and be really open and honest with ourselves and with everyone else about that. But the tendency more often is to avoid, isn't it? And to um, pretend it's okay, to bury those thoughts and feelings, to try and push away thoughts and memories. We get a flashback, we push it away. Um, we may turn to substances to help with that. We may use our busyness, distraction as a technique. So we may fill our lives with, I don't know, work, study. I think that's something that I certainly did. I threw myself into studies repeatedly throughout my life and into work. And I think that was for me largely a way of avoiding at times. It's been a gradual unfolding, I think, over many, many years of me kind of approaching and then taking a step back from that, looking at my trauma, taking a step back from that. I've dipped in and out of bits of therapy at different times. I've dipped in and out of different bits of self-help at different times. I've, at times completely avoided thinking about anything that's happened to me. And then at other times, I've tried to learn to practice things like mindfulness um, and meditation, and actually really stopping and just letting myself be with what's real and, the reality of my existence and my past and everything. And, I have a certain level of tolerance for that. But then I think that's been an ongoing journey for me, that, you know, I can approach more of my past now than I ever could. But I think that's something that happens over time. I think you learn to approach it. I think sometimes what happens is people throw themselves into avoidance very, very hard. So, you know, you think about your combat veteran who's seen horrific things, maybe in the Middle East or Afghanistan or somewhere, and they come back and the only real coping skill they've got is alcohol, for example, and they throw themselves into that. And then, of course, that causes its own problems, doesn't it? And so then that becomes quite a downward spiral of avoidance and needing to drink more to keep the memories at bay. And, you know, if you do try and stop the drinking, then the memories come back all the more strongly. And so I think this is an ongoing struggle often for people who've been through trauma, is how much do you approach it and how much do you avoid it? And how do you pace that journey of acceptance and moving on, and you know, really getting to grips with what's happened.
And I think that, you know, what you've explained is actually life, regardless of whether you've had a trauma, inverted commas, or not. It's life, isn't it? You practice,
Yeah,
you go up and down and everything's a trial. But
yeah,
obviously with trauma, it's slightly more highlighted for
yeah.
various reasons. But, you know, we've used the word trauma a lot, but I think it'd
Mm-hmm.
be helpful, and as you do define in your book, what is trauma?
Well, it's many different things to many different people, I suppose. If you asked an orthopedic surgeon what trauma is, he'd start talking about broken bones and car accidents, probably. Um, Whereas if you talk to a psychologist about what trauma is, we very much think about the emotional impact of things that have happened to us. And if you were to speak to a solicitor who works in personal injury about trauma, then he or she would probably talk about, you know, whether something reaches some sort of diagnostic criteria to qualify for a certain level of compensation in a personal injury case. So what we define as trauma depends on what context you're talking about in. When I'm working with people in therapy and they come to me with, you know, a history of bad things having happened and they're struggling with the outcome of that, I'll talk about trauma as being the things that have happened and the impact that's had on them in a very loose way. And I won't worry about diagnostic criteria and whether this meets a certain threshold to qualify for, let's say, post-traumatic stress disorder, PTSD, or complex post-traumatic stress disorder, CPTSD, or whether it's something less diagnostically relevant. I don't get into all of that with people. When they come to me with problems, what I'll be talking about is, okay, you've been through a lot of stuff, haven't you? And that feels like trauma to me. And we've got trauma therapies that can be helpful for that. And we've got skills you can learn to manage day to day with these difficulties that you're having. So we've got coping skills to teach people. We can teach them about typically how trauma impacts people, how it affects your brain, how it affects your body, how it affects your behavior. We can talk about those kind of things, and that we call that psychoeducation, you know, just helping people to understand what's happened and why it's impacting them the way it is. And then we've got specific trauma therapies, such as trauma-focused cognitive behavioral therapy, and my favorite, EMDR, eye movement desensitization and reprocessing therapy, which are really, really good therapies for taking people back to what actually happened, having a jolly good look at it, and reprocessing the thoughts, the feelings, the images, the body sensations, all the things that are left in the body after we've been through something difficult, very difficult.
And does that use hypnosis to regress? Is it, I mean, is that regret? It's not quite regression
No,
therapy, is it?
no, it's so hypnotherapy, and I have trained in hypnotherapy a little bit as well. Hypnotherapy, people aren't quite as aware of the here and now, of the present moment when you do hypnotherapy. You kind of put them into a deeply sort of trance-like state, and they are less aware of, you know, the traffic going past or the, I don't know, wind in the trees or whatever that's happening in the here and now, and they're back in their mind in a more deeply relaxed state often, recalling stuff as it was then. With EMDR, we're very, very keen for people to be as much one foot in the present and one foot in the past. So we're not sending them right back into the past without the present awareness, if that makes sense. So when we do EMDR, we very much want the person to be aware that they're here, it's now, and they're in the room with us or on the screen with us. And, you know, we do all sorts of things to keep them grounded and present, whilst also recalling and having in mind that memory from the past. And in the process of EMDR, what we do is we apply what we call bilateral stimulation, which can be either eye movements, side-to-side eye movements that, you know, while they're thinking about their traumatic memory and knowing they're present here in the room, their eyes are going side to side. And that sets off, you know, processes in the brain seemingly. I mean, I'm not as hot on the sort of research of exactly how and exactly what the processes are neurobiologically while we're doing that. But research is showing that, you know, there's a very strong process that happens when we do that bilateral stimulation. We can do it, it doesn't have to be eye movements. That was how it was invented back in the late 80s, early 90s. It was noticed that eye movements had impacts on sort of how we feel about things. And then over time, people have found that other forms of bilateral stimulation, so for example, tapping on alternate sides of your body has the same impact. Alternate sounds in your ears has the same impact. Even walking, if you can walk, I can't, so it doesn't work for me. But the bilateral stimulation of your feet tapping on the ground as you walk or run can have the same impact. So going for a walk whilst thinking about a traumatic event and possibly scanning the scenery with your eyes going side to side maybe, you know, can help to reprocess old memories. Now, I wouldn't recommend people just go out and do that on their own without sort of some therapeutic support first, because we don't know always, you know, when we start connecting with one traumatic memory, what can happen is the earlier stuff that we've not really thought about very much can bubble up to the surface as well, and that can become overwhelming. So we don't recommend people go off and try and do EMDR on themselves, because it can be a little bit dangerous and people can become very overwhelmed very easily. So you do need the support of a trained EMDR therapist with accredited training. I would say that's really important. You know, it needs to be someone who's, you know, done the accredited training and has, you know, a good history of mental health therapy work behind them to guide you on that process of trauma processing.
Yes, because it's no good churning it all up, and then what do you do with it?
Exactly.
I think, and it was the treatment that you had, wasn't it? Was that?
I've had EMDR, yeah. I've trained in it and I've had it. So my journey with being, say, a client in EMDR therapy started with my EMDR training. So I went off in, when was it, 2012, 2013, I think, to do some EMDR training with EMDR masterclass. I went to train. So I was a qualified clinical psychologist. I'd been qualified a few years. And I really wanted to add EMDR to my toolbox because I was working with a lot of complex trauma. And I really thought EMDR sounded like the thing that was going to help unstick a lot of the stuff that was very stuck in the people I was working with. So I went off to do my EMDR training, and a very important part of EMDR training is always the practical sessions where, so you do half a day of having a lecture and then half a day of kind of practicing on each other in small groups, and then another half day lecture, another half day practicing on each other. And that's how the learning grows over the course of the EMDR training. So the practical part is really, really important part of the training. And so I went off merrily to my EMDR training, and it is said in the sort of preparatory information, make sure you've got some idea of some things you can work on that are going to be nice and safe and suitable for a training event kind of thing. And I thought, oh yeah, there's you know, various things, you know, a little bit of bullying at school, I could maybe do that, or maybe just feeling a lack of confidence at work sometimes, not being able to speak up in meetings, those sorts of things. So I thought, oh yes, I'll take those along and maybe work on those as the things I'm going to do. And of course, the thing that happened was in the very first practical where I was acting as the client, started working on something fairly innocuous from school time. And very quickly, my mind took a leap back, initially to a memory at about 6 years old, but then very quickly again back to a pre-verbal memory of being about a year to a year and a half old, and being hit by my father, like knocked into the middle of next week by my father, who was really cross with me and my brother for playing dens in our bedroom when we should have been asleep in bed. You know, just a very normal sort of family situation where the kids haven't gone to bed, they're playing, they're mucking about. Father comes in, rage ensues, and whack, knocked into the middle of next week. I had no recollection of that memory until that afternoon in my EMDR training. And I was back there very much in a sort of what we call abreaction in therapy terms, you know, very much back there kind of in the moment and only just hanging on to a sense of awareness of the present moment whilst processing this thing. And that was really quite a revelation to me. And it just absolutely proved to me beyond any reasonable doubt, because I'd gone into my EMDR training thinking, I really hope this is going to be useful. But actually, it sounds a bit weird and I'm not really sure I believe in it. And so we'd had like the first morning or two of lectures, and it was sounding more and more like crazy talk. And then I find myself in this situation doing this, you know, having this processing done with me and on my real stuff, and then it's right back to very early stuff. And you know, this is the reason we don't recommend people just go and try and do EMDR on themselves, because you don't know where it's going. You don't actually know all your stuff. I didn't know that that had happened until I was there processing it. And then at a later date, you know, sort of, I don't know, sometime after that, I spoke to my brother and said, do you remember something about this? And he said, oh, actually, now you're saying it, I'm getting chills down my spine. That reminds me of something. Oh, yeah, there's something. But he'd also blocked it out. But as soon as I mentioned it to him, he was like, woo, woo, you know, this is something. So in that sense, I kind of fact checked it against, you know, the only other person who could by that stage, because by the time I was talking about that, I can't remember, I think my father was dead by then, but I certainly wasn't talking to him anyway. So I couldn't really fact check it with my father. But, you know, my brother pretty much did confirm that something like that had happened around about that age. So in that particular house, we were able to kind of date it by which house we thought we were in when that happened. So yeah, that was just really kind of transformative for me personally and professionally.
But I think, you know, leading on from it, what that did was that that event unlocked so much for you to move forward in seeing your father later, and then not being afraid of him, and all the things that you describe in the book as to, and from what I can understand is it then allowed your self-confidence to really then start believing in yourself to move forward.
Absolutely. I mean, I did then put myself into EMDR therapy with a local private practitioner for a period of time, which was really transformative. Sometime a couple of months after that initial training, I did visit my parents' house, which I tried always to keep to a minimum, but did have to kind of show willing every now and again and go and visit. But every time I went to visit, I would always be holding my breath, really tense in my body, just knowing that I wasn't comfortable around my father, and this was just how it was. It had always been like that. I'd always felt tense. I'd always held my breath around him and always been waiting for the next challenge. But that couple of months after I'd done that piece of processing in the training, I went for this visit and I was breathing normally, and I noticed I was breathing normally and that I wasn't as tight in my body, and I was kind of you know, just more willing to sort of speak out when he, I don't know, he was probably sitting there reading the Daily Telegraph and making pronouncements, which was one of the things that he tended to do. And, you know, he said something and I challenged it. And I would never in my life before that have challenged something he said. I would have just, you know, sort of had an argument in my head with him about it, but not out loud. You know, but I did. I just said, well, that's not right. And then just backed up my argument confidently. And that just really started to give me confidence going forward in speaking up more at work, speaking up more in my day-to-day life, thinking about going into private practice. That was something that was just way too scary for me at that point. I was working in the NHS thinking, you know, I had to stay in this system that was paying a salary and paying into my pension, and I got sick leave and whatever other leave I needed all provided for. And you know, that confidence to take the leap into private practice where you haven't got that, all those safety nets, I suppose, but just believing that I could go into private practice and actually, you know, it might work. You know, just that confidence was transformational as well.
So it's learning to find the blockers that you don't necessarily know that are there. And then
Yes.
once you've challenged that blocker, you then find actually it wasn't perhaps as big as you thought it was. And it
Yeah.
allows you to move forward, which, you know, with trauma is I suppose it's facing that, understanding what it is, and then seeing how you can move forward.
Exactly. I think when we go through something traumatic, we learn things about ourselves that we hold on to that are often not helpful. So we might learn that we're out of control or that we can't control things. We might learn that we're helpless or vulnerable. We might learn that we're not safe. We might learn that we're worthless. And I think that was a strong one for me from how I'd been brought up. I had a strong belief that I was worthless and that my thoughts didn't matter, my opinions didn't matter. I was somehow less than everybody else. When we go back and process those old traumas, it's almost as if we notice those negative cognitions about ourselves, and a part of us starts to say, hang on a minute, you know, we connect with more adaptive information, which is, no, I'm no less worthy than anyone else. I have as much self-worth. You know, we connect with, like, you know, obviously by this stage, I'd trained for a long time as a therapist, and I would say to people, no, of course it wasn't your fault. You know, of course you're worth more than that. Of course you deserved better. But I wasn't applying that to myself. I knew in my head, but I wasn't connecting with the felt sense of I deserve better or I am worthy. And that's the difference. When you go back and process those old traumas, you let go of those negative cognitions and you replace them with more adaptive, positive cognitions about yourself. You learn to say, I am worthy. I do have something to say. My voice does count. And that just makes a huge difference to things like being able to write a book. You know, you've got to believe your words matter in order to put them in a book and send it to a publisher.
And
I wouldn't have done that earlier.
well, I was going to say, well done you, and that sounds really, really patronising. That it certainly isn't. So, just sort of to round up, what you know, what I thought was great about your book is your book covers everything that we've just discussed. And I think you said you put a sort of warning at the beginning of this conversation. And I would also say that warning to read the book, because you know you have to be careful when you read through it, because as soon as you read about some therapy, you can automatically relate it to yourself. And
Yes.
you know, your book is, I think it's 188 pages or something like that. So it's not a thick book, but I could see
No.
that it could take you a long time to work your way slowly through the book in helping
Yeah.
yourself, which is the book has, and I thought especially the appendix at the back, it's got everything to help you and different methods, the methods that we've spoken about today, ACT and whatever that one was.
EMDR. Yeah.
And I think there was cards and there was different scores. So there's a lot of things that may relate to different people as to how it would help them. So give them a start as to how to move forward.
Yeah, absolutely. Absolutely. I mean, there's loads of different things that you can do. I mean, there's things drawn from all sorts of different forms of therapy. So you mentioned ACT, which is acceptance and commitment therapy. Key aspects of that are being in the moment, being very mindful, being aware of your values. So thinking about, what makes life matter to you. If you only had a year to live, what would you want to fill that year with? That identifies your values. And so, if you've got a sense of what matters to you, whether that's family, success, money and wealth, friendship, charity, there's an endless possibility of values out there. If you know which ones tick your boxes, then in every moment, what you can do is you can just take a deep breath and think, what's my next best step to connect with my values? Life might be going all over the place. It might be very chaotic. You might have demands coming at you from work, from kids, from family, from whoever. And you might be thinking, oh gosh, I don't know what to do next. But if you can just take a breath, get back in the present moment, calm yourself a little bit and think, what's my next best step in this moment? Then you can just slow things down and not feel quite so overwhelmed and just take that one next step, and you've moved in the direction of something worthwhile then. And that, I think, is just a really important strategy. And I do list all sorts of strategies. There's a set of exercises that's called the 4 elements exercise that I absolutely love. And my clients love it too. And it's very much about getting yourself in the present moment by sort of literally just, if you can, pushing your feet into the floor, feeling gravity pulling you down, checking in with your surroundings, doing 5, 4, 3, 2, 1 with your senses. 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can taste, 1 thing you can smell. Just bringing yourself into this moment, what's real right here, right now. And that's the earth element. And then you can move up the body into the wind element or the air element, and you can put your hands on your tummy and start getting your breathing under control. You can slow your breathing down. You can just notice it going all the way into the pit of your stomach, and that soothes your nervous system really, really well. So just getting your breath under control. So feet on the floor, that's the grounding. Hands on your tummy, get your breathing under control. Then to pull yourself out of a panic attack, you can trick your nervous system into thinking that you're not in fight, flight, panic mode anymore. You're actually in calm, rest and digest mode just by getting your mouth watering. So either by taking a sip of a drink or imagining biting into a lemon. If you get your mouth watering, it causes you to swallow. And then as you swallow, it turns your digestive system on, which when you're in fight, flight mode or panic mode, your digestion shuts down. Because there's no point digesting your breakfast if you're about to be breakfast for the wolves, basically. So that's kind of an evolutionary thing. Our digestion shuts down. So if we can trick it back on, then that helps to soothe our nervous system, gets us back into this rest and digest state. And then the 4th element, so that's the water element. And then the 4th element is the fire or light element, which is about firing up your imagination, lighting up your imagination. So imagining a happy place, imagining supportive others, imagining symbolic resources, strong oak trees, protective wolves, predators, those kind of things. If you need a sort of, your own personal bodyguard, you can conjure him up in your imagination and take him with you. If you need, what else might it be? So if you need a wise guide, someone to give you wisdom, you can conjure up maybe, I don't know, the Buddha or Gandhi or Jesus or, I don't know, whoever, Allah or Muhammad or whoever floats your boat spiritually or religiously, or it could be a primary school teacher or anyone who represents that sort of wisdom to you. And those set of exercises can be just really useful to just bring yourself back to the moment, regulate yourself, calm down, relax, feel protected and safe, and then prepare for your next best step. So that if there was one thing you needed to do, it would be that set of exercises, I think.
Yes, and it's very well written in your book, very easy to understand.
It's explained in a bit more detail. I've rushed through it there in a way that kind of skims over it a bit, but you know, it's explained why those things are helpful in the book, obviously in more detail.
Thank you very much for sharing your own story and also some great stuff to help everybody. Thank you very much, Yvonne.
You're very welcome. Thanks for having me on. I've really enjoyed it.
Thank you.